Good morning, everyone. Welcome to the third edition of our Brown Bag Lunch Learning Series for frontline workers in Waterloo Region. The topic for today's session is access to services in Waterloo Region, regardless of immigration status. I'm Tara Bedard, Executive Director of the Immigration Partnership and your facilitator for today's session. I would like to extend a warm welcome to all of our presenters and attendees. Your presence here is, really a signal of your commitment to our shared goal of helping immigrants reach their full potential, and we truly appreciate that. June is Pride Month and Indigenous History Month in Canada. As we begin today, I would like to acknowledge the traditional custodians and the land on which we live and work. Other than our Indigenous neighbors, we are all immigrants who have settled in this place at some time, seeking to be welcomed and wanting to reach our full potential. This acknowledgement is a way of honoring the land on which our successes have been built and the Indigenous people who have been living and caring for this land for thousands of years. So the land we come to and are on today is the traditional territory of the Haudenosaunee, Anishinaabe, and Chinootan peoples. This land was promised to the people of the Six Nations and is on the Haldimand Tract, taking in 6 miles on either side of the Grand River. We acknowledge the enduring presence of the Indigenous people with whom we share this land, their achievements, and their contributions to making our community a great place for everyone. We offer this acknowledgement as an act of reconciliation between Indigenous and non-Indigenous peoples in Canada. Many organizations make up the Immigration Partnership in Waterloo Region. Our vision is that immigrants will reach their full potential and contribute to creating and sustaining a thriving community for everyone. We work to create the conditions for immigrants to succeed. Today's learning session has been designed with our settlement leaders to equip you with the information, tools, and resources that you need to help your clients meet their needs. For the next few hours, lots of experts from our community will be sharing information about a range of services and programs available for international students, temporary residents, refugee claimants, and people without status in our region. We invite you to submit questions in the Q&A throughout the presentations. Our speakers will address all of the inquiries that we're getting during the Q&A session. So we're going to have some presentations and then Q&A sessions to follow. And now I'd like to dive right into our agenda for today. We are starting first with a panel with our post-secondary institutions talking about supports available for international students in Waterloo Region. Please join me in welcoming our speakers, and I invite all of you to turn on your cameras now. From Conestoga College, since 2012, Janet has had several positions within the International Office at Conestoga, and in her current role as Associate Director of the International Student Support Services team, she directs the day-to-day operations of both the International Student Immigration Advising Team and the International Transition Coordinator Team. Julie is the manager of the International Student Support Services at Conestoga College and is responsible for the day-to-day operations of the International Transition Team. Thank you both for joining us. We are also joined from Wilfrid Laurier University by Charlene Mack and Jane Desmond. Charlene is a learning consultant on the Student Success Team at Laurier. She has worked for more than 10 years directly with international students and is a registered International Student Immigration Advisor. She sits on the board for the Chinese Cultural Association in Waterloo Region and is vice chair of the Immigration Partnership Settle Steering Group. Jane has been an immigration consultant since 2004, and in 2018, she joined Laurier as an international student advisor. Thank you both for being with us today. And finally, we have from the University of Waterloo today, Candice Brown and Cynthia Bratton. Welcome. Candice is the manager of international student experience at the University of Waterloo and a regulated Canadian immigration consultant. She was herself an international student, and she and her team support the transition, integration, and personal development of approximately 10,000 international students at the university. Cynthia is an international student support specialist and has over a decade of experience in higher education, with the past 7 years dedicated to supporting international students through their various stages, from recruitment to post-arrival. Thank you, everyone, for joining us today. This is a really important topic. You know, there are a growing number of international students in our community. They are on your campuses and they are out in the community. And I think it's really helpful for all of the community organizations to understand the full breadth of the programming that is available to students through the universities and the college in the region. So I'm going to jump right in. I have a number of questions that I'm going to pose. I'm going to direct each of them to one of you and then like one of your institutions, and then ask if the others have anything, you know, kind of same or different that you'd like to add for the different institutions. And then once we're finished with the questions that we have set, we will move on to Q&A questions that are being posed by some of our viewers today. So the first question that we have is around food security programs in the region. And I think I'll start with Conestoga for this one. How does Conestoga work to identify and assist students experiencing food insecurity? And what are the programs and resources that you offer to food insecure international or other students?
Thank you, Tara, for the question. And hi, everyone. I'm super thrilled to be here today to share about Conestoga and also to learn from all the other wonderful institutes that we have today. I'm sure that we all have a lot to learn and, you know, to share with each other. So talking about food security topic, I think that we all know that this topic has gained a lot of attention lately. So at Conestoga, we have the Student Nutrition Access Program. We call it SNAP. Which includes a college-run food bank as well as other food initiatives. You know, in response to the growing need that we see in the region, Conestoga established the Food Security Collective in the fall of 2023 as well. So member of this collective includes representative from our student success team, our student union, CSI, faculty, and current students. So this collective, the goal for this collective is to bring all of these key college stakeholders together to provide a platform for us for information sharing, for response planning, and also it's an avenue for us to implement a collective impact for food security and nutrition awareness for our students. So we work very closely with community, you know, connect student with community resources, such as food banks, church, community leader, and not-for-profit organization, so that, you know, we can better understanding the need of the student and we can form an appropriate response plan. So we know that sometimes students new to Canada, you know, they are not familiar with our system, so they can be falsely informed that this is free grocery at the food bank. So there's this education piece there, you know, for us to share with students as well. So we have identified 24 different initiatives and recommendations to help alleviate food insecurity and provide support for, you know, our students. So just to name a few here, you know, I know that we can talk all day about this, but I just want to share a little bit of the, you know, initiative that we have at Conestoga. So we have the SNAP Emergency Food Fund, and that aims to provide access for nutritious food and meal for those experiencing, you know, or at risk of food insecurity. And we also have the Affordable Produce Program, which allows students to purchase fresh and healthy produce at a discounted price through our on-campus market. And it happens twice a month at all campuses. We also have our weekly Nourish and Go program, in which our student union, CSI, provides students with complimentary grab and go fruit and snack at each campus. And we have a no-cost good food and gratitude series. It's feature team dinners that including community building, entertainment, and also food option, you know, at no cost for students. And so we also have a lot of programming, you know, to implement on top of this, and it run around, you know, the whole year to provide knowledge and assistance on various topics. And this include nutrition-related workshop, virtual cooking class, gardening activities, etc. So just to name a few there, I know that at the Institute have a lot to share as well. So I guess, you know, it's time for me to pass it over.
Thank you, Julie. Can I invite anybody from Laurier or from Waterloo to talk about what might be the same or different on your different campuses?
Sure. Hi, everyone. My name is Charlene. I'm from Laurier. Thanks for having us. Laurier, also, like all the other institutions, we do our very best to make sure that the international students that come here are aware of the cost of living. So we've tried different ways to let them know about not just like the rent, but the cost of food and things like that. So that's how we try and mitigate or manage their expectations a little bit. But we all know that that's not always what the reality is. So at Laurier, we also have different food programs that happen weekly. We have Distro, Mini Mart, like the food bank and hampers from the student union. So all of those things. We also have something called the free store. It's not food specifically, but it is a store where you can go in and students can take household items or things that they might need to help support them in other ways. And then it frees up some finances that they might need for food or rent or things like that. And the free store runs, I believe, from September to the end of April, like the normal school year. And there's days where students can just go in and you basically just take whatever it is that you need. And all that they ask is that you weigh whatever it is that you take, because that's how they sort of keep track of everything. So, all of those food programs, whether it's, free food, discounted food, all of those things. And we also try programming that we provide always includes some sort of like food as an incentive, but also just that students can freely come in and grab something if they need to and take it to go with them. Yeah. So thank you.
I'll jump in here, Cynthia from University of Waterloo. A lot of great supports already mentioned, and they exist at the University of Waterloo as well. So similar to Conestoga's collective, we do have a food support strategy committee. And similar to Laurier's hampers, our Waterloo Undergraduate Student Association runs a confidential food support service that assists with food hampers as well as general hygiene and menstrual hygiene hampers, which also the food ones cater to some dietary constraints as well, providing meat, vegetarian, halal, and kosher. And in addition to those, there is Renison University College just across the creek here, and they offer a community fridge and cupboard that is open Fridays from 7 a.m. to 7 p.m. And just like Charlene mentioned, access to discounted food through faculty student societies also exist at the University of Waterloo.
That's awesome. Thank you. That's a huge range of programming addressing food security issues on campuses. And I think it's good to hear that and know, because it is an issue very present in the news, and helpful for organizations to understand like what students can be directed back to if they're coming out into the community seeking those supports. I'm going to move us now towards immigration supports, something that also is very relevant for international students in our region. And I think I'll ask one of our colleagues from Laurier to start on this one. What does Laurier offer in terms of immigration support services to international students? What immigration processes do or don't you, or can or can't you help students with? And what do you do when a student is seeking support from you that you can't help with?
Yeah, thank you. And so in terms of immigration support, we have 4 international student advisors on campus, 3 in the Waterloo region and 1 in Brantford. And we do have drop-in immigration support available for students once a week. We also host webinars pertaining to not only temporary resident visas, study permit, work permits, postgraduate work permits, and permanent residency as well. So I think with the current news we've seen, we need to think a little bit more outside the box and support our students options and what they need to look for. So these are the primary programs that we offer students here at Laurier. We don't do the programs, the applications for them, but we do support them step by step, and they can book out times with the advisors and send us emails, and we will then address their queries. And sorry, just in case, we can also refer them out to lawyers in case the case is more complex or needs to seek appeals or another review.
That's great, thank you. Can I invite colleagues from Waterloo or Conestoga?
Sure, I'm happy to add to that. Excuse me. So at the University of Waterloo, we have a team of 6 regulated Canadian immigration consultants. This team offers one-on-one appointments to students, information sessions, and they also have a quite diverse website that includes a video library as well as a document template. Support is provided to both new and current Waterloo students, as well as recently graduated students, 8 months or less after their last term. The support that they provide includes everything from study permit, working on campus or off campus, co-op work permits, TRVs, ETAs, post-graduation work permits, permits for TRVs for spouses, common law partner, and or children. Requirements to enter during COVID-19 pandemic was something that they also did. They share information about Government of Canada resources, like how to get a social insurance number. In total, they've offered 6 permanent residency information sessions, 3 on express entry and 3 on OINP. And then they invite as well folks from IRC to come in to deliver presentations as well. New this year, they are providing supports for incoming students, and they've offered so far 6 sessions as well as one-on-one appointments that include parents once they've accepted. The consultants do not offer support to students looking to discuss or apply for permanent residency. However, they direct them to IRC as well as advise them to consider seeking help from an immigration consultant in the city or an immigration lawyer. To give some context as to the scope and the breadth of their work, in 2023, the immigration consultant team saw a total of 7,164 students. They responded to 10,653 emails and had 2,503 students attend their sessions.
I'm going to be very cognizant of timing, but I'll just echo exactly what my colleagues have said. At the other 2 institutions, we too have a team of 10 immigration experts. They're either RICIAs or RCICs. Much of the work they do is very similar to our colleagues. They help students navigate IRCC rules and regulations as related to their specific academic situations. So for example, if a student has to drop to part-time status, or they need to take a leave from studies, or they want to defer their program, anything that might affect their future immigration status as an international study permit holder. We also similarly assist with study permit renewals, work permits, co-op work permits, postgraduate work permits. But again, we don't submit applications on behalf of our students. We just give them assistance. We have representation at all of our campuses and one-on-one advising appointments, drop-in sessions, extensive programming to educate students on IRCC and related topics. We have workshops on how to apply for your study permit or co-op work permit, what you need to know about applying for your postgrad work permit. We do joint sessions with IRCC and Ontario Immigrant Nominee Program that provide information about pathways to permanent residencies. And when the things that we don't advise students on, that's not within our scope of work, we would guide them to appropriate resources such as the College of Immigration and Citizenship Consultants to find a licensed immigration specialist to provide advice and guidance. And we might suggest using the services of an immigration lawyer who specializes in their area of need. And also we would look at information sources on trusted online resource sites on the internet. So that's kind of how we assist our students related to immigration.
That's wonderful. Thank you. I'm going to move us towards health-related topics now, and I will invite colleagues from the University of Waterloo to start on this one. Can you tell us about on-campus health services and the health insurance available to international students? Are there gaps in coverage that you know of for students? And like, what happens when those arise? Is there any way that the post-secondary institutions are able to try to assist students that come up with health issues that go beyond what their insurance covers?
Certainly, I'll tackle this question. So I'll start by saying that on campus at University of Waterloo, there's a student medical clinic that students are able to take advantage of, as well as international students can access the family health clinic. This was established in 2014, and it does provide primary health care to families of our international students. These services are available for the duration of the student's studies, and if needed, up to 6 months after graduation. And with respect to coverage, I'm sure I'll speak on behalf of all institutions here. International students have university health insurance plan. So UHIP is the primary healthcare plan for those studying and working at universities in Ontario. So this is compulsory coverage, and it provides benefits similar to OHIP, which is the Ontario healthcare for residents. At Waterloo, sorry, there is there is the graduate and undergraduate extended health and dental plan. So this covers anything that UHIP doesn't, which includes prescription, physiotherapy, chiropractor, massage therapist, etc. And if for any reason there is any gaps in coverage, we do help our students consult private providers.
That's great. Thank you. From Conestoga, Conestoga or Laurier?
Yeah, sure. I think I can stop. I can talk next, I guess. So yes, regarding campus medical services, I think that, it's very similar and Hemseren as well. So for on-campus medical services, we have these service available to own register full and part-time international students at Conestoga. And our service include drop-in first aid support, daily walk-in appointments, and also appointment visit, either in person or by telephone or by video as well. So, some, services that would be provided are diagnosis and treatment of illness and injury, sexual health, specialist referral, mental health support, etc. Very similar, to what the other institute are doing. And in terms of health insurance, we do have, health insurance at the college, and that would be under a different name. So for us, that would be Conestoga International Health Insurance Plan, which is CHIP, similar to OHIP. And this plan is administered by CSI, our student union. And the cost is included in tuition, and coverage includes medical and life insurance, benefits all of this up to 5 million in coverage, including physician care, diagnostic testing for illness and injury, hospitalization, and emergency surgery. And I want to note that, students can also enroll their dependents who travel to Canada with them. However, this is for an additional cost. International students are also offered an extended health and dental coverage plan, and this plan would provide additional coverage for other medical services, including prescription drugs, vision care, and also dental care. And so as the case for most insurance policy, I would say, pre-existing conditions are not covered, and students are responsible for the cost of any and medical expenses that fall outside of the policy eligibility. And because our medical clinic on campus is nurse practitioner lead, and they are paid through our operating budget. So in some case, we are able to provide service to international students who may not have coverage for specific ailments. We absorb the cost of care. So this also, trying to help students. And talking about service, I want to mention that we have a wellness office operated by our student union, and they offer a virtual drop-in session to answer any wellness questions students may have. And the wellness coordinator also helps students to book appointments with our on-site registered physiotherapist and chiropractor. So finally, in addition to all of those services and support, students also have access to a 24/7 65 days per year, basically, to licensed health professional and mental health providers through Dialogue app, which is a virtual healthcare platform that we provide, in the healthcare plan. So talking about gap, we do know that, with insurance, there would be some gap. So a gap may occur when a student arrives with pre-existing condition, like what I mentioned earlier. Or maybe they will be, present with a medical condition that is outside of the scope of our on-campus practitioners. Another gap may exist when students who arrive more than 1 month before their study begin. So as part of the International Student Health Insurance Plan, we do offer emergency-only coverage, which takes effect up to a month prior to the first day of class or on the date of their arrival in Ontario, whichever comes later. So at Conestoga College, we are a firm believer of early support, and we want to inform students about the health insurance plan well in advance. So approximately 3 months prior to the class start, we reach out to incoming international students to provide information and resources to educate students about the health insurance plan. We invite our student union, Student Care, which is the insurance provider, to talk about that and answer any questions students might have. So just a way for us to make sure that students are well informed even before they arrive in Canada.
I feel like Laurier has very similar policies as are in other institutions. So we as well, we have UHIP and we have like supplemental health and benefits for both undergraduate and graduate students. On our campus, if you encounter any students that need support in terms of like health services, our campus, on both campuses in Waterloo and in Brantford, we have the Wellness Center, Student Wellness Center, and there's doctors, registered nurses, counselors, dietitians, chiropractors, massage and physiotherapists are available by appointment there. A lot of them, some of them have drop-ins as well. So if you ever have a student and they're not sure where to go or how they can access these things, absolutely have them go onto campus, because all of these services are available for them. If there are any gaps or services that they can't access when they need it, they can certainly come to the International Student Support Office, and we either help make that connection to the wellness center, because there's always someone there. So we can help with a soft handoff, or we can refer them to some of the partner agencies that we work with in terms of getting support like mental health and things like that. So I think that's the only difference between us and some of the other institutions. So.
Okay, that's great. We had a question that came up in the chat that was very specific and related to health. It's disappeared, but I'm going to ask it because I know it comes up in the community, and it was with respect to pregnancy. So just to clarify, I'm going to go based on what Julie was saying. If people arrive in the country pregnant, that will probably not be covered because it is a pre-existing condition. I myself experienced that when I moved home to Canada. But if they become pregnant once they are here, that would be covered through insurance. That is correct, is what it sounds like. Can you just confirm that? Because there was a specific question about that.
Yes, that is correct, Tara. Pregnancy is covered if the student becomes pregnant once they've arrived in Canada. If the student becomes pregnant before they arrive in Canada, not covered.
Okay. I'm going to then move us on to our next question. And there was a little bit of talk about some mental health supports in some of the discussions you were just, or the responses to the health related question, but just to hone in on mental health and wellness specifically, are there specialized services that international students can access? Are they free for students? are they culturally or linguistically appropriate for international students, or would they be a part of the broader suite of supports that are available for everyone else? And is there any particular focus around mental health for international students, particularly during high stress periods like exams or around the holidays? Maybe I'll start with Conestoga this time, if that's okay.
Sure. Okay, I'll take that one on. So the short answer is yes, absolutely. We have a very fulsome range of supports for international students. And I know I'll leave somebody out here, but we have 11 counselors, we have 4 nurse practitioners, we have a physician, we have a mental health coordinator, a health promotion specialist, and we have peer wellness navigators. The counselors are diverse in background, both culturally, sexual orientation, gender, lived experience, and of course, counseling at Conestoga for all students, including international, is free, voluntary, and confidential. Our counselors participate in ongoing cultural sensitivity training. Similarly, our medical clinic has 4 nurse practitioners and a physician addressing both physical health and mental health needs of international students. They're diverse. They also have collective experience working on community health teams that serve diverse clientele. And we will access translation services if needed in both counseling and our medical clinics. Our mental health coordinator acts as a liaison between hospitals and the college for students who need to access hospital for mental health concerns. And our peer wellness service, that's kind of a neat service comprised of trained Conestoga international students. They're called peer wellness navigators, who utilize their own past experiences with mental health and wellness to offer supportive listening, resource sharing, drop-in groups, and the connection to on and off-campus resources. Our health promotion specialist provides targeted initiatives to international students, specifically including guest speaker sessions, alumni connections, and other opportunities to increase students' awareness of mental health support. And last but certainly not least, we have our Conestoga College Care Team, which is comprised of representatives from a diverse group of college departments who have received specialized training to support at-risk students. So any member of the college community, including students themselves or friends of students, staff, and faculty, can refer students to the care team for elevated support and care. And the care team is here at the college to help students achieve their academic and personal goals in a safe and welcoming learning environment. So we work very hard on the care team to act swiftly when students are referred so that we can get them the mental health supports and academic supports, whatever they need. So it's a really all-encompassing program of mental health care for our students.
Thank you. Charlene or Jane, from Laurier's perspective?
Do you want to go, Jane? You're muted. Yeah, you go ahead.
You can go.
Okay, I can go, no problem. So in terms of mental health for international students, we do have racialized like counselors that's recent that we've started so that they kind of have a better understanding of the different cultures of students that we have coming in. We also have counselors that go into specific offices. So there's counselors that go into the international student office to meet with students if they want to, or just be there for drop-in. We also have like a counselor that goes to the Faculty of Graduate and Postdoctoral Studies for graduate students who don't want to go in and see anybody, like any of their students, with the rest of the general population. We also work closely with the Delton Glebe, which I'm sure a lot of my colleagues from the other institutions are familiar with as well. They are right across the street from us and offer a lot of great supports for our students, so we work with them as well. Our whole institution, in terms of mental health, when we look at the strategy, it's very holistic. So between the International Student Support Office, the Wellness Center, and the Dean of Students, they meet often with student cases and things like that, just to make sure that the student has wraparound service that supports them both in their wellness, in terms of their international students status, and academically at the whole institution. So they work on that together. We also have lots of events and things like that throughout the year that talk about wellness, mental health, just in general. And then I also wanted to point out that we have a gendered and sexual violence prevention and supports office. So if you're working with an international student from Laurier, absolutely refer them back to the international student office for any support that they might need. However, if our student is disclosing some sensitive issues or concerns to you, and they might not be comfortable disclosing this multiple times, we can provide the reference for you later, but you can refer them directly to the gendered and sexual violence office and have them work with the student directly. And those people in that office will then make the appropriate referrals and bring in the appropriate supports on campus as needed. So that would be my suggestion. Any students that have any needs, they can absolutely come to the Wellness Center or International Student Support. And if it's something that's sensitive, absolutely refer them directly to that office. And we'll provide you guys that information of where to refer the students to, depending on the situation.
Thank you. Candace or Cynthia?
Yes, certainly. So I'd like to probably echo a lot of what my colleagues have already said. Many of as to what exists at those institutions are also available here at Waterloo. So we do have counselors that provide free counseling services to students that include counselors who have lived experience and who are also identify in many of the categories that are international students and other student populations may see themselves within. In addition to that, we also have MATES, which is a peer support counseling service, who are volunteers that are trained by counselors for students who are interested in more of that peer-to-peer perspective. In addition to that, we also have, and I think I heard a few of the other institutions mention it as well, we also have programming that extends beyond one-on-one counseling services that include things like 2S LGBTQIA plus student spaces, grad student spaces, journaling spaces, running spaces, Black student support spaces, students with diverse cognitive profiles. And in the fall, we'll be offering spaces for international students that allow them the opportunities to unpack the experiences of moving and integrating into a new culture. Resources are also provided to support students in developing coping stress management in their pre-recorded workshops. In regards to, there was a question earlier in regards to strategies that our institution employs to ensure international students are aware and have access to mental health resources, particularly during those high stress periods. At the University of Waterloo, our communications teams work closely with all of our student support services to come together to develop a communications plan to identify periods of time. So whether that's exams, whether that's events that have recently happened, so natural disasters, conflict, etc., and to develop a plan in terms as to what the key resources are, what the students need to know, and how they're communicating those messages are shared out during that point in time. So that's shared out via social media. So through our Waterloo Life account, we also have an institutional WeChat account that is shared out through as well. For international students specifically, we have an International Student Connection newsletter. And at times where the unexpected happens, we also do targeted email communications to students. So for example, world conflict, natural disasters, we will send out targeted emails to that specific population, but as well to the broader population, naming and identifying what has happened, as well as communicating the supports that exist at the institution for them. In the winter term, recognizing that for many of our international students, they may be experiencing winter for the first time. We also have program that supports international students in adjusting and learning how to dress for Canadian winter, how to stay active and get out during a Canadian winter. And that's offered through a program that we call Waterloo, that offers both a connection piece, so for students to gather at events, but also for students to build community amongst each other, as well as there's weekly emails as part of Waterloo that gives them tips for navigating a Canadian winter. So things like really very tangible, like how to do the penguin walk, how to watch out for black eyes, how to dress in the winter, those types of things.
That's great, thank you. I'm going to move us towards the Q&A, and the first question that we received is linked to what was my last question, so I'm just going to pull them together, and this is about context. When students are showing up at organizations out in the community and they're looking for, our community partners are looking for like how and where to refer students back into the institutions. Can you share, like, what are the best places to point students to when they are in the community seeking support? And like, where should they be referred to back on campus? And we had a very specific question posed by one of our participants, a link or contact number or email specifically for the immigration consultants at the institutions, and any information that you can share on kind of when those offices are available. Maybe who hasn't started for a while? Maybe Conestoga?
Sure.
Thank
Happy to answer that. So, you know, hopefully we've been able to portray the extensive supports and services we do have for all of our students. I would say a really good starting point is always the Conestoga College website, and in particular the international web page. So for example, if you're asking specifically about immigration support, there is a way on the website that you can identify who the appropriate ISIA would be for a student, if they can give you some of the information about their program or their campus. Other than that, I think the email is internationaladvisor@conestogac.on.ca. And of course, we'll provide all of this contact information for you. For the international transition coordinators, that would be help with early onboarding, housing, and general transition. We have career services for employment information and support. We have many academic service supports, such as student success advisor, learning services, tutoring services, academic integrity, student rights and responsibilities. Counseling and medical care would be the contact for mental health issues. If a student needed some accessible learning service accommodations, we have an accessibility department that can help with that. Of course, financial aid for students that have finance concerns. We have security services for safety concerns. And we do also have a sexual and gender-based violence prevention and support office. So I guess maybe the shortest answer is just reach out to Julie and myself. Again, we'll provide our contact information, email us. But maybe to avoid a student getting different information here and there, it's also good for you to be able to just become familiar with our website to see if you can point them in the direction that they really need. But we're happy to help in any way we can.
Thank you. And just I'll reiterate, we actually, I don't know if I mentioned it, we will be sharing out all of the information and resources that have been shared in the session with all of the participants. So we'll be gathering up this information and putting it out to everyone. And I just want to remind people to put all your questions in the Q&A. We're going to do our best to get through all of them, and those that we can't, we will follow up with once we're done today. Maybe Candace or Cynthia, what's the best starting point for referrals back to University of Waterloo?
Sure, yes, definitely. So we would suggest that community partners refer students directly to us on the International Student Experience team. Our email will put it into the chat, but I know it will also be shared out with the resources. We're happy to connect students with the appropriate resources at University of Waterloo and kind of figure out what it is they need. Oftentimes when students come to us with one thing, we later realize there's a host of other things that they need support with. So for that, we suggest that you reach out directly to us and we will help them navigate and identify the resources, supports that they need. New in the spring fall term, the international teams in the Student Success Office will be moving to a dedicated space, which will be the International Experience Center. So we're hoping that as a result of this space, it'll help students in finding us more easily and be able to identify the supports and resources that are available to them. And specifically in regards to the immigration question, immigration, students can make same-day appointments via portal, and we'll share the link and that information as well as to how it is they can get in contact with the immigration consulting team.
Wonderful, thank you. And from Laurier?
Yeah, from Laurier. Go ahead, Shirley.
I was just going to say, Candace, just remind me of something. So each of our institutions might be slightly different. At Laurier, our immigration advisors are part of, they sort of do everything, immigration, but also supports of everything else at the institution. So for Laurier students, it's usually the best if you have them or if you refer them to or connect with international student support. I've put all three of the institutions' contact information into the Q&A there. So, but as everybody's mentioned, you'll get it at the end. So that's all I think I would say is that for Laurier students, have them connect with international student support because they'll be able to help them with everything or refer them out as the hub.
Yeah.
Sorry, Jane, did you have anything to add?
Just to add that this is the most appropriate method, either by connecting with the international support services or emailing, and I think you have already added the email as well, so thank you.
Okay, thank you both. Our next question, I think, is probably the same for all. What happens to health insurance and other health services during summer vacations? Like, is that all still operational while students are here if they're, I guess, on a break, like they're not in class for a semester, like over the summer? Are they still able to access the clinics that you've been talking about on your campuses? Is the health insurance still valid in the semesters when they're between studies?
So for you Waterloo students, absolutely. So they'll continue to have access to that coverage as well as being able to access the health services that are available on campus.
Yeah, it's the same for Conestoga. So our policy year starting from September on the way to August. So let's say if the students start in September, the policy year will run into August next year. If the students start in January, that will be from January to August. So they will have full access to the health insurance and health services on campus.
Okay, thank you. Same for Laurier? Great.
Yeah.
Okay.
Yeah.
That's good. Our next question comes in and is, what would happen in the event where a non-student family member separates from the student who is at the institution due to domestic violence? Are they eligible for any services that they might, I guess, that they might have been able to access as a spouse of the student for the duration of the school term? Who would like to start with this one? Waterloo, how about you for this one?
Sure, that's a very good question.
Thank you.
And not one that I'm entirely certain of the answer to. It's something that I think I might have to take back to our team and ask them. I think it may be dependent on whether or not the dependent is still attached to the insurance, but I imagine the institution would likely work closely with those in need to identify what the resources, but I would have to take that back to the team because I'm not certain.
Okay, yeah, and that's totally fine. We would appreciate if you would then take that back and then we can share that out in our follow-up with everyone. From Conestoga or Laurier?
That's a good question as well, and it needs to be on a cases by. I don't know the complete answer to this, but I would say it's on a case-by-case basis, and we would have to look if there were any police orders in place so that the person would not be able to access certain spaces. We would have to check how we can protect the student or the person that's the victim. So I think definitely needs to be further investigated and a better answer brought to you.
Okay. So it sounds like this one is one that we should do some follow-up with, and then we'll share that out with everybody in our post-session follow-up. Okay, so our next question that came in, sorry, I just lost it. I think this was around some of the mental health supports that you were all speaking about that you have available at your campuses. How do you regulate these programs to ensure they are culturally sensitive? I've heard various experiences, both positive and negative, regarding the use of school counseling services and what can be a lack of cultural understanding. Do all staff members receive regular training? And what steps can students take, or will the school take, if students have a negative experience? Who can start with this one?
I can.
Charlene, thank you.
Let me go first, Janet. I bet you have a better answer.
Sure, not necessarily, but go ahead.
So I think we've heard this before where students have come back to us and said that they've sought counseling and it lacked some, cultural nuances and understanding on their part, which is why I think for us, we've started to be a little bit more, cognitive about how we hire and where we place some of our counselors. So we are working towards that. And again, I'm going to mention the Dalton Glebe because they have phenomenal services that students do come back and tell us that they're great. In terms of if there's still something that we're missing, or if a student does encounter a negative interaction, I would encourage them to come back to the institution, not specifically that counselor, obviously, but if they go to the International Student Support Office and let them know, one of the ISAs know that they had an experience, then we'd be able to walk them through, okay, what happened? And then we would take steps to go from there. Certainly, if there are lots of issues with a particular person, that's going to be that'll be escalated and taken a lot further up the chain. But that's what I would suggest, is that we are aware that there are some times there's gaps and lack of understanding. We are working to hire more people with certain lived experiences so that they can address these things appropriately. And then I think it's just students need to tell us, or you can tell us on a student's behalf if they've allowed you to do that, just so that we're aware. We try to let students know that they need to advocate for themselves. We can't change anything. We can't help them if we don't know. So that's what I would say. If you or a student can come back and let the institution know, then that's how we can start making these changes. Yeah. Okay.
Thank you.
I don't know that I have anything to add beyond what Charlene has indicated. I think similar here at Waterloo, our team of counselors, our counseling unit is making a concerted effort to ensure that the counselors at the universities represent our student population, in that they have similar lived experiences and identities that align with our student population. Our MATES program as well, they are peer-to-peer and our students themselves. So I think that's an opportunity there as well. And like Charlene has mentioned, I think it's important for us to know if it is students have identified issues specifically in those areas, so that we can take it to the appropriate areas, which would be our campus wellness unit.
Thank you.
And I think just to wrap it up for Conestoga, much of the same. Again, we have diversity in our staff, our counselors for similar cultural backgrounds, sexual orientation, as I already mentioned, diversity in the makeup of the teams as best we can. Obviously, there is ongoing and rigorous cultural sensitivity training across all areas of the college. In addition, we take any kind of complaints or accusations very seriously. Students can report to security. And of course, we do a lot of education for students from other cultures about the role of security and that they can be trusted and you don't have to bribe them and all that kind of stuff. And so we have our security in place. We have a student rights and responsibilities department where students can lodge complaints. Also, the care team, many of these kinds of things will come through the care team where a student says, I think I'm being discriminated or whatever the case is. Thankfully rare, but obviously these things can happen. So I think we're all on our toes at Conestoga to address these issues as soon as they're brought forward and there is a process in place to deal with them. And just one other thing, our international transition coordinators, the team that Julie's primarily responsible for, as she mentioned, they reach out very early on to students offering webinars, one-on-one meetings, way before students come to Canada. And so usually students will have a soft connection there, right? They see their name in a presentation, on an email blast, whatever, and students will often feel safe and comfortable coming to one of the transition coordinators with, their story or their concern because they feel that that's their first connection at Conestoga, and we build those connections, intentionally. So from there, we take things where they need to go.
Thank you. So we have 4 minutes left and 2 questions, and I'm hoping that these two have a pretty quick answer. The first is about, I guess, cost coverage for medications for students. The example given is medications required for mental health. Are these covered through the insurances that international students have medications?
So at Waterloo, international students have supplementary insurance via our Huesca and GSA health insurance that covers prescription. However, specific coverage will be dependent on the medication, the insurance, and we wouldn't have any idea unless they've done a predetermination, what's covered versus what's not covered. But as a umbrella, yes, prescription is covered. Specific medication, students would need to do a predetermination with the health insurance coverage company.
Okay. And that's, I guess, the same as for us with OHIP. So, okay, I'm going to assume that that's the same for all of the institutions. Yes, great. The next question then was, in the event the student is here with a partner who has a work permit, once the partner begins working and becomes OHIP eligible, how does this or would this impact the student's upcoming or outstanding tuition fees?
Probably the same for all of us. Again, once a student has, you can opt out of UHIP. So that's the equivalent to OHIP. So students can opt out of it, but they absolutely need to be able to show that they've got equivalent coverage. So once their partner and they are eligible for OHIP and have proof of that insurance and health coverage, then they can make the request to be exempt from the UHIP and thus not have to pay that fee. You do have to be careful of the timelines though, because I don't believe that they do it like all the time. So you might have to do it like partway through your year or something like that. And that would be on the website about those deadlines. Yep.
Okay, that's great. And we had one more person sneak in a question, and we still have 1 minute. I'm gonna throw one of them at you. On the topic of food security supports and stigma for using free services. How are the institutions trying to, kind of reduce stigma around food insecurity, food security issues, and really encourage those students who need supports to access those supports that you were talking about on your services or on your campuses? Sorry. This is, I guess, like communications and encouraging people to not be afraid to use the services. Is that happening on campuses?
I think the services that we offer, they are for every student. And as mentioned before, they pay their fees, they have the rights, and it's every time on occasions there are times when we need, like the service is confidential. So if the student fills out a form, we will process it, deliver to the student in a way that really it's confidential. So the student shouldn't be afraid of reaching out to an advisor, even in terms of if there is a need for an emergency bursary, or like, we will assess the situation, we will work with the student, we work with the institution to make sure that this need is addressed. We have programs, different programs, but one that comes to mind is called Cooking 101 here at Laurier, where students come every week and they cook together, cook food, different dishes from different parts of the world, depending on the number of attendance participation that they have had over the semester. They will get like an air fryer, and they can then take on, they can learn about safety, they can learn about promotions, how to save money, etc. So I think in terms of the presentation, or in terms of what the institutions have put in place, we have quite extensive programs in place to address this need that we know is very latent in our community. So the students should not be afraid of reaching out to us.
Thank you very much. I'm going to end us here. We've now reached time. I would really like to thank all of you for joining us today. It has been eye-opening for me to hear about the breadth of the supports that are available on all of our post-secondary campuses. There's a few more questions. We will follow up with them in our post-session follow-up, and with all of the information that you have been providing in the session today and in the chat to get that out to everyone. We hope this has been helpful for all of our settlement partners to understand what are those services and supports that are available, and how to make the connections for students back to them if they're showing up in spaces out in the community. And I'm going to move us on. So thank you all so much. Really appreciate you being here today and taking the time. It's been really great. Our next session, we're moving away from specifically discussing international students in Waterloo region and focusing on those migrants who are in our region who have also a temporary status or no status. They might be migrant workers, might be refugee claimants, could be somebody without status. And I'd like to invite our first panelist today, Dr. Jenna Hennebry. Jenna is an internationally recognized scholar with expertise on migrant worker rights, health and social protection, labor, migration governance, and gender in migration. She has had long involvement with the Immigration Partnership and is a member of the Canadian Council for Refugees Subcommittee on Migrant Workers, the International Organization for Migration's Migration Research Leaders Syndicate, the UN Expert Working Group on Women's Human Rights in the Global Compact for Migration, and the UN Migration Network's Working Group on Bilateral Labor Migration Agreements. She is co-founder of the International Migration Research Center that is at Laurier University in Waterloo region, who we work very closely with, and is co-founder of the Migrant Worker Health Project and the Migrant Worker Health Expert Working Group. She brings a ton of expertise here today, and she's going to talk to us about categories of migrant workers and all of their complexities and what this means in communities like ours for the next 10 minutes. Thank you, Jenna, and I will stop talking.
Thank you so much, Tara, and thank you to the Immigration Partnership for the invitation, but also just generally for being able to shine a light on these important issues and to support work being done across the community to address some of the challenges that we're facing with respect to newcomers in our community. So just a general shout out to the Immigration Partnership because I think they're doing amazing work. So I'm going to share my screen. I have a brief presentation, and I thought I would spend a few minutes just talking a little bit about what some of the different categories around temporary or non-permanent migrants are in our community. Can everyone see my screen? I think they can. Excellent. Then I'll continue. So talking a little bit about the complexities around temporary resident populations in the region. And we've already been talking about some of those complexities with respect to the international student population, which makes up our non-permanent resident population. But there's much more in terms of the different kinds of categories, and we thought we'd spend a few minutes talking about those and sharing a little bit of information and some resources that we're working on developing. So, huge range of categories of what makes up the non-permanent residents that are in the region. There are those that come through the International Student Program that we were talking about. There's those that come through the International Mobility Program. Those are people that are under agreements, free trade agreements, those that are coming under company transferees. There's a whole bunch of different categories there. Then there's the temporary foreign worker program, which is much larger. And it covers a whole range of different categories, and I'll talk about those in a few minutes. One of those categories that is important to separate out is also the seasonal agricultural worker program. And it is a unique program that has basically been the same since its inception in 1966, and it's managed under bilateral agreements between different countries and Canada, so Mexico and the Caribbean states and Canada. So it's a little bit different than some of the others, so it's worth pointing out. And I'll talk a little bit about what some of the nuances there that are important with respect to the experiences of temporary migrants in that particular program. And then we also have visitors, and it's important to flag visitors as well, because visitors are also part of the temporary population. Many of them, sometimes we have super visas. We have people that might be coming for really long periods of time, like 5 years as visitors, or for short periods of time, 3 months or 6 months. They might have things like private health insurance, but they also might be staying with people that have work permits. And so they might be tied into to other sort of groups of temporary migrants. And so they also have particular kinds of needs. And then we have those that are covered under the sort of more special measures. For example, with the more recent visa for Ukrainians. And so that's the gamut. But then we also have people that don't have status at all for whatever reason, which usually has to do in Canada with people almost always arrive with status, whether it's a visitor or a visa or a work permit, but then something happens that truncates their ability to stay with status. So either they fall through the cracks because they don't have their visa expires, for example, or they can't transition to permanent residency. We have scenarios where people then become refugee claimants and are in the process of trying to sort out an asylum claim. And so they also fall into that category of temporary or non-permanent residents. My slide is not moving for some reason. There we go. So I'm not going to go through all of these. We don't have time to talk about the complexity, but all I wanted to do was illustrate just how many categories there are under the temporary foreign worker program in particular. We have the high wage stream, the low wage stream, the primary agricultural stream. I put the seasonal agricultural worker program in there, that's separate. We have what used to be called express entry. We have caregivers, we have global talent, and then we have the student work permits. There's a whole range. And then we have also, and we also have the spousal permits as well. And so underneath that category, temporary foreign worker program, there's a whole bunch of different variability in terms of the different packages of supports, of access to rights, and the kinds of eligibility they may have for certain programs and others, right? In most cases, under the temporary foreign worker program, we're talking about employer-specific permits, which means that employers have to have done a labor market assessment to get the access to being able to hire that temporary foreign worker under the program. It typically means that workers have, in this stream, they will have tied work permits, which will name a particular employer. In addition, in many of these streams, there are obligations around housing that tie into that as well. So, for example, in the seasonal agriculture worker program, housing must be provided by employers. In the ag stream, there must be housing available, and that employers can ensure that there is housing available, for example. Caregivers, there are also some scenarios there as well around housing. The International Mobility Program is often we talk about open work permits here. They can sometimes be employer specific, and they're basically, they don't have to do an LMIA. They don't usually have to provide housing, and they include a whole range of things here as well. And here's some of them. I'm not going to share a lot here, but just to say that we've had a really significant growth in the number of temporary migrants in the region over the last decade in particular. And certainly we're now at a scenario where we're seeing that we can estimate. It's usually estimates because it's tough to figure out who is here based on the statistics and data we can get from IRCC and from the census. And so we can estimate that we're somewhere between 70 and 100,000 temporary resident holders in the region, but that's not counting those that don't have permits, that don't have status at all. So the number's probably quite higher. So they face a number of unique needs and issues, and they encounter a number of issues, particularly those that are tied, well, that connect to different program streams, and permit type, permit duration, all those things impact the kinds of things that they may experience when they're here. Human rights violations have been well reported and by scholars and by the media as being significantly higher in those that are underneath the temporary foreign worker program. In particular, we're looking at things like exploitation, abuse, trafficking, forced labor, violence and harassment, including but not limited to sexual and gender-based violence. In terms of labor rights violations, we have scenarios such as wage theft. We have harassment at work, unsafe working conditions, which our colleague from OCAL will be talking about a little later, and also living conditions, unsafe living conditions, and issues around access to other kinds of labor rights like collective bargaining. Lots of health risks that are particular to this group or heightened for this group that range from injuries in occupation and to things like heat exposure, food and waterborne disease, communicable and infectious disease, as we saw was particularly heightened during COVID, for example. And they face all sorts of issues in terms of housing-specific health issues as well, bed bugs, a whole range of issues there, including mental health. We also, in part because most of the temporary foreign workers, particularly those in agriculture streams and the SOP, are experiencing family separation because they are not permitted to have their families join them. A great deal of insecurity and precarity that range from loss of work time right through to loss of income potential. Loss of status is quite common, and experiences of detainment and deportation. So all this amounts to a lot of particular barriers to access to services for these groups, and they range from barriers to accessing employment and labor supports. Often ineligibility is a factor, housing and transportation in remote areas or areas where they don't have access to communication or transportation. They are separated by often family separation is a factor, and having access to when their children are here to be able to have access to the services that they need. Immigration services, often they're ineligible or they don't have the right documentation, or there are no pathways. Health and socio-legal, they'll have different kinds of barriers to accessing that range from language to ineligibility. Also, social protection like pensions and disability insurance are really difficult for people to access, and workplace safety insurance when there's been an accident. All of those barriers are why Kitchener in part has recognized how important it is to have an access without fear policy, which was approved in 2022, and it's rolling out now. They're doing a whole series of education sessions and information with service providers, ensuring that there's access to services regardless of status, so that people don't get into a cycle of precarity and where it makes things much worse because of fear or because of ineligibility for services. So we also have at the local immigration partnership, what we're doing is a migrant worker coalition, and this is the coalition that I chair, and we've got lots of great community-based organizations that are involved and service providers that are involved. We've been sharing information, we've been scanning our supports, we've reached out to many of you to help us understand those. We're planning a Migrant Worker Appreciation Day that we want people to be involved in. We have website resources that will be going live this summer, and we also are doing much more that we want to share with you. Some of those things we've compiled that we're going to be sharing in the website and in other venues involve, we've identified what are the sort of best organizations to start with for community sports, for example, for healthcare services, for legal aid and support, for security in the workplace, and for situations of abuse and exploitation. So I'll stop there and say that's the scope of what we want to be able to talk about. We'll share all of those resources with you as well. And now we get to also hear from some amazing folks from some of those very organizations. So Tara, I'll turn it back over to you. Thank you.
Jenna, for setting the stage for the second portion of our learning session today. And everyone, Jenna will be back later. She will be moderating the Q&A at the end of having heard from all of our speakers in this portion. So you're going to get to hear a lot more of all of the wealth of knowledge that she has. I want to remind everybody that, please do use the Q&A to put in questions as we're going through. They will come back later, and Jenna will be moderating that. I also want to encourage everyone to stretch and hydrate. We're here for a bit of a marathon session today. And I would now like to introduce Eduardo Huesca. Eduardo, hi, thank you for joining us today. Is a program coordinator at the Occupational Health Clinics for Ontario Workers, Inc., a position he has had since 2014. In his role, he supports vulnerable migrant worker communities in Ontario, including newcomers, refugees, agricultural workers, while working to address policy gaps and improve occupational health and safety services. Eduardo, over to you. I'm having trouble hearing you, Eduardo. Still not. No. Maybe what we can do is move on to our next speaker, and maybe if you leave the webinar and come back, that will correct it. I don't know. Saba can maybe work with you on that. Imtenan, would you be okay to... Oh, sorry, was that working there?
Oh, can you hear me now?
Now I can. There you are. Go ahead.
Sorry about that. It's just, always, we practiced it and always something gets a little bit of a surprise. Okay, sorry about that then. Thanks so much. I'm Eduardo Huesca. I work for the Occupational Health Clinics for Ontario Workers. So I'm going to just be talking a little bit about occupational health and safety and precarious status workers and some experiences that we've had and some considerations that hopefully are helpful to other agencies as well. And we really, are always really interested in collaboration. As I'm going to get to, we're a provincial-wide network of clinics. So, please reach out to us if there's any interest in, supporting you in your work with communities in terms of with occupational health and safety. So again, as I mentioned, OCAL consists of a network of occupational health clinics throughout the province. I kind of flagged the Hamilton Clinic, which is the catchment that includes Waterloo, the Waterloo region. That's actually where I'm physically right at the Hamilton Clinic, and that's where I was hired when I first started. Each clinic does a little bit of different work depending on the worker populations around in that region. So sometimes, we work with construction workers, manufacturing workers, agriculture workers, which is my experience, but also healthcare workers in hospitals, long-term facilities. So it really, our work shapes around understanding the experience of work of the workers, the exposures, and we try to do our best then to respond in supporting them. In terms of just kind of like a base understanding, we always, even in our educational presentations to migrant or newcomer workers, we, share information about the Occupational Health and Safety Act. So the Occupational Health and Safety Act is the legal framework of regulations focused on health and safety of Ontario workplaces. It sets out the responsibilities of all workplace parties, including employers, supervisors, and workers, and it sets the procedures for dealing with workplace hazards and the enforcement of regulations. And important to note that these rights and protections and duties under the Occupational Health and Safety Act apply to all workers regardless of immigration status. Obviously, that's sounds great. In practice, it's more complicated than that, as I'm going to get into, but the Act does recognize that. Also, the Act is a minimum standard, so workplaces can go beyond this, right? They could work together, workplace parties could work together to really have health and safety policies that are proactively looking at new hazards that may come up that might not necessarily be detailed in the Act itself. And the Act is enforced by the Ministry of Labor. And I mentioned kind of that minimum standard because as we're seeing, with rising temperatures or the fact that in Ontario we now have forest fire smoke that is reaching different communities where it didn't reach before, things are changing. There's new hazards that are going to come up. So we're always working to really push forward in terms of keeping workers safe. This is a little bit of a visual that we also use for educational purposes, just to understand even just the concept of hazards and the categories of hazards. So you'll see, there are hazards that can be safety mechanical, chemical hazards, biological hazards, ergonomic design hazards, which is great that you mentioned about stretching when we're, sitting a long time. A lot of people think ergonomic design of our work desks, but also, in packing houses, whether, let's say, in manufacturing, tables are at a height so people are not, hunched over and looking at kind of the positions and movements that people are doing. Another category that is often overlooked is stressors or work organizational hazards that can be where we look at workplace mental health, psychosocial factors, and that kind of doesn't get as much attention as it should. We always kind of talk about health and safety in terms of everybody has a role to play, but employers, according to the Act, employers have the most responsibilities when it comes to health and safety. And it's because obviously they control the work environment, the pace, the tasks, and so therefore they do have the most responsibilities according to the Act. One useful concept that we use when we're looking at our work with newcomer workers, as well as migrant workers, is the idea of vulnerable workers. And in no means do we mean an inherent vulnerability kind of associated with the person at all. It's really more of a structural imposed vulnerability on worker groups that, again, I can mention. But this is something useful because when we came across this measure, and it's was developed by the Institute for Work and Health based in Toronto, and they're kind of leading a lot of research in terms of newcomer health and safety. It's a really interesting measure because it looks at a worker being vulnerable if the coming together of either hazard exposures, workplace policies and procedures, workers' awareness of hazards and their rights and responsibilities, and their empowerment to actually participate in raising concerns or trying to prevent injury and illness. And with a lot of newcomer workers and migrant workers, we see this measure really showing that they can be often found in high hazard industries, as Jenna mentioned, but also in industries where sometimes there's inadequate workplace policies or procedures, or training is not occurring in effective manners. They might have themselves low awareness of their rights and how to navigate health and safety at their workplace, what to do if they get injured. They might be lacking that information, but they also might be discouraged or feel fearful of raising concerns as well. And just the Institute for Working Health has a lot of articles, and I can share that in the future too if people are interested. I'm not going to spend too much time on this, but this might be a familiar case study to many of you. This was a worker that was seen at one of our clinics where he was a recent refugee, and he was working at a home renovation store, picking up barbecues and loading them to transport trucks. And in one occasion, he injured his back. He didn't report his injury to WSIB. He noted to us that at the time he was fearful of losing his job. He had heard that other workers had been dismissed when they were injured or fired when they were injured, which is illegal. But he didn't know what to do, and he didn't know much about health and safety. When he actually presented at our clinic, he was now in a lot of pain. He was having trouble walking, and this is kind of a complicated case that sometimes we see among communities. Most of our experience has also come from our work with migrant agriculture workers. So this is some photos from our programs that we've run since 2006. And kind of similar to the idea of vulnerability, this also kind of touches on why there's a need to really do outreach to these communities in terms of health and safety. So a lot of them, again, are employed in high hazard industries. Sometimes people talk about 3D jobs, dirty, dangerous, difficult. There's also kind of the idea of social determinants of occupational injury and illness. So the idea that a lot of these communities are experiencing poverty, they might have limited opportunities back home, literacy challenges, housing challenges, precarious immigration status. Often they're working ununionized workplaces. So the precarious character of their employment sometimes means that they're very reluctant to raise concerns because they're fearful of losing their job or not being able to come back under the program, as Jenna mentioned as well. As Jenna mentioned, there's experiences barriers accessing healthcare, and just overall, a lot of the reporting systems for health and safety have not been accessible to these populations, whether it's reporting to the Ministry of Labor around unsafe conditions, or whether it's reporting to WSIB in terms of a workplace injury or illness. Oftentimes, as I'm going to touch on, these workers really need support navigating these systems, because even for most, these are quite complex systems, let alone when they're not, in worker languages, or if they're all online, when there's connection issues or internet navigation barriers experienced by communities as well. And that's to say that the health and safety system in Ontario has been really slow to respond to the needs of these workers. I do use one kind of great or positive, example of workplace health and safety with migrant workers. This was a farm that we visited that we had nothing to do with, but basically these workers identified that these wooden baskets were causing them back pain, just based on the fact that they didn't have really proper handles and they were kind of circular and awkward to hold. So the workers themselves, these workers are from Mexico, let the supervisor know. And basically, the supervisor jumped in, got baskets. They ended up being cheaper and resolved this issue. So that's kind of showing the working together, but oftentimes this is not necessarily all the cases. And I know I'm gonna basically I'm running a little bit out of time, but the one thing I just wanted to kind of quickly go to in terms of lessons that we've learned for health and safety is just the importance of sustained outreach and trust building with these populations. If you want workers to trust you and to navigate their health and safety concerns, they have to know you. You have to have a presence in the community. We could not do our work without our outreach workers. And the challenge with our outreach workers is that they're themselves are precarious positions. Our funding doesn't allow them to be full-time permanent positions. So that is something that I think that agencies, we really need to rally around is permanent funding to have, the folks that are in the community that are there connected to people have full-time work, well-paid work, because it really, our programs can't run without them. I used to be an outreach worker and now I'm less in the communities, but I depend on our outreach workers now to be there. Resources being accessible formats is so important. This province has been really slow. Now we're seeing a lot more, but we've really tried to push that forward. Really talking to workers about how to exercise their rights, in like spelling it out in resources. But beyond the exercising, the challenge is that even when workers know how to navigate and claim rights, you really have to see you really need caseworkers, right? Really helping navigate. So here this was just published yesterday on this really great case in Nova Scotia of workers winning $23,000 for being wrongfully dismissed after raising a health and safety concern. And Stacey Gomez, we've had a pleasure to work with her, funded through the same way. She does amazing work. But this really takes a lot of work for agencies to rally around workers to kind of push a case forward like that. And many workers fall through the cracks when there's not caseworkers available. And I'll just end there. And legal clinics are so important. Legal clinics are the ones that really are being able to help and actualize the claiming of rights of populations. Thanks so much.
Thank you, Eduardo, for that whirlwind presentation. I know it's a huge and very important topic. And we look forward to coming back to, I guess, dig into some of the nuances later in the Q&A. I really appreciate you being here today. I would now like to welcome Imtenan Razik, who will share insights on the legal support services, a very good segue from Eduardo's last point, available for precarious, people on temporary work permits, people without status in Waterloo Region. Imtenan is an experienced immigration staff lawyer at the Waterloo Region Community Legal Services, where since 2019, she has been dedicated to assisting low-income clients with a wide range of immigration matters. Thank you, Imtenan, and over to you.
Thank you, Tara. Can you hear me?
Yes.
Okay, and my presentation has been shared? Okay, great.
I can see it, yes.
Thank you. I'm so happy to be with all of you today and to benefit from hearing what everyone else has said. It's really helpful to me. So I hope it's what I have to say will also be helpful to somebody. So I'm just going to talk today about our clinic, Waterloo Region Community Legal Services, what services we offer in all the different areas and how to qualify for them, and then what immigration services we have specifically for those with precarious status. And that's where I come in, because I'm the immigration lawyer at our clinic. So I'm going to try to be fast. What do we do at Waterloo Region Community Legal Services? One of our major areas is income maintenance, so ODSP appeals, CPP, etc. Employment for wrongful dismissals. We can help people get entitlements if they haven't been properly paid, etc. For housing, we have a large housing practice that assists tenants only, not landlords, trying to help people maintain their units. Immigration, which is my role. And then we also have notary and commissioning services. So who qualifies for legal aid? I just wanted to assure everybody that, first of all, part of our intake process doesn't have any our intake process doesn't have any questions about immigration status. You don't need to be a Canadian citizen. You don't need to be a permanent resident just to make an appointment at our clinic and talk to somebody about a problem in any of those areas. If your issue is not immigration itself, but your status is relevant to that, then the council will advise you during the consultation process, but it's not a barrier upfront. What we do ask upfront is we apply the normal legal aid criteria, which is geographical. Our clinic serves Kitchener, Waterloo, and Cambridge. And the second criteria is financial. So there are income thresholds. So what are those thresholds? Just so people have an idea. It depends on the size of the family unit and the combined income of everybody in the family. So if there's a family of 5 or more, they need to be making less than 50,803. If it's one person, they need to be making less than 22,720. And if there's slight variations from this, we can sometimes make some exceptions or just offer summary advice. We also look at assets. So if one person has more than 8,933 or a family has more than roughly 12,000, they wouldn't qualify financially for legal aid services. For those who do qualify, our help can range from summary advice to full representation. And it's important to know that, of course, like any law office or any legal environment, the information is confidential. We'll never report immigration issues to anybody. We don't have an obligation to do that just because we're government funded. You can be assured that your status is safe with us. How can you contact us? There's two ways to begin to approach us for the first time, either by phone, this is the number, or you can make a web form through our website. Or we also have some walk-in hours which are available on the website. You can see them, they change sometimes. So please just check the link. And we have two offices. Our main one, which we work at every day, is 450 Frederick Street. We also have a Cambridge office that we can make appointments at for anybody, any of our clients in Cambridge. And it's also open for walk-ins Tuesday to Thursdays. So now we'll get to the part of talking about what immigration services are actually available. So for refugee claimants, that's the first category. Most of these kinds of cases are covered by legal aid certificates, not the clinics. So what we try to do so that we don't reproduce services that are covered by certificates is a lot of times if someone is contemplating making a refugee claim and they're not sure they want to do it, they're not sure whether they have a good chance or what the implications might be for the status they already have or what the wait times are, etc. We can definitely provide some advice, but especially on the legal part, if someone is trying to figure out whether they have a viable claim, we can assist them in that so they can make that decision. Secondary thing that here, another group is temporary residents. So for workers, we've spoken about in the vulnerability of migrant workers. A lot of them in abusive situations have the option of applying for an open work permit so they can get away from the control of that abusive employer. And our clinic has been successful in helping several migrant workers do that. Students, we also can provide advice or representation on maintaining student status, transitioning to a postgraduate work permit, or talking to people about their chances of permanent residence through express entry. As some of the other speakers mentioned, express entry is becoming increasingly hard, but at least in the past, we used to be able to give people a good idea of whether the job that they're considering after graduation would qualify them for express entry under Canadian Experience class, whether they are ready to apply, how they could boost points, checking their totals, and sometimes even representing them. A third category, and this is probably one of the very relevant ones, is people without status at all. So there's a number of options for them, and we do all these kinds of cases in our clinic. So one of them is humanitarian applications. Often these are the best for people who have lived in Canada for long periods without status and have established themselves, and especially if they have children, but that's not necessary at all. Another class here is temporary resident permits. So people who are in a similar situation to the first category, but they don't necessarily need to stay permanently. You can request a TRP, which sort of fixes their status for a short period that would allow them to complete something they have to do here. For example, if they're in a family court battle and they expect that to take a year, they can request a TRP to allow them to be in Canada legally while they sort out their affairs. A TRP can also be helpful to try to maintain or obtain status if you've applied for permanent residence. So as a way of trying to make sure that your status in the country is secure while you await another decision. A third scenario that we see is spousal sponsorship, where a Canadian or permanent resident is married to someone who has been out of status for a while, and we can help people with that too. Being out of status is not an outright barrier to sponsorship. You can make some special submissions and try to fix that in the course of a sponsorship application. And finally, there's just one other category. So for people whose permanent resident status is threatened. So we often see people who have permanent residence already, but then they face a criminal charge or they have a conviction, and we can try to help them hold on to their PR. If the conviction hasn't already happened yet, we can advise whoever's representing them criminally on what outcomes would save their status. If it's already post-conviction, we can try to navigate an appeal for them if there is a right to appeal, and try to help them hold on to their PR. So that's the end. Thank you very much. I look forward to any questions in the later panel.
Thank you so much, Imtenan. That was really good information and nice and clear. So
thank you.
Really appreciate that, and I'm sure helpful for everyone who is joining us today.
My pleasure.
And we'll see you a little bit later in the Q&A. I'd now like to invite Chris McEvoy to join us. Chris is with the region of Waterloo. He is the manager of housing policy and homelessness prevention. Has over 15 years of experience in public policy and social development. And he's here to talk to us about some of the shelter or housing supports that are available for people with temporary status or maybe no status in our community. Chris, thanks for joining us today.
Excellent. Thanks for having me, Tara. Can I just confirm you can hear me to start?
Perfect.
Brilliant. Thank you. So good morning, everyone. Thanks for joining. And thank you to Tara, yourself, and Saba and the Immigration Partnership for hosting this session. I'm just going to work to share my screen. And I believe I'm doing that now. Can I have someone confirm? Perfect. Thank you so much. So as Tara said, my name is Chris McEvoy, and I work as the manager of homelessness and supportive housing within housing services at the region of Waterloo. So housing services is one division within the Department of Community Services. And we live in a two-tier municipality, so the region of Waterloo is a service system manager for housing services, which means we have some responsibility for coordinating the development and creation of new affordable and supportive housing, and share some of those responsibilities with our lower tier city and township partners. So I'll go through today and talk about a couple of specific programs and services in the community that are available for folks residing in Waterloo region or residents of Waterloo region, regardless of residence. So just in terms of setting the context and stage a little bit, I thought it was important to talk very briefly about the region of Waterloo's Growing with Care strategic plan. We are a community that is anticipated to grow to 1 million residents by 2050. And so having a key pillar of homes for all, ensuring that Waterloo region is growing and working towards being a community where everyone has a place to call home is a really important aspect and pillar of the Growing with Care strategic plan. And I won't go through all of the information on this slide, happy to provide these slides afterwards, but just wanted to center today's conversation on the larger plan and growth. So within housing services, our vision is that we're working towards being a world-class community for all residents. And integral to this cross-departmental plan is the commitment to making housing affordable for everyone, because we believe that communities can and will and do thrive when everyone has a place to call. Whoops. So when I talk about the region's role as a service system manager, it really falls into the 4 key buckets that you see there in the bubbles of homelessness and supportive housing, which is the portfolio that I have the privilege to work in, which I'll speak a little bit about today. We also then have client services in Waterloo Region Housing, where we as the region are a landlord for about 3,700 affordable housing units. We then have housing programs, things like rental supplements, not-for-profits and co-ops, the affordable housing waitlist, as well as other affordable home ownership programs rest within that housing program section. And then affordable housing developments. We have a whole team working on how do we, as a community, as a region, create new affordable and supportive housing. So those 4 bubbles there represent the 4 distinct service areas within the region's role as a service system manager. And what you see along the bottom is what we call the housing continuum, different experiences of housing and housing stability. From the left-hand side of experiences of homelessness and unsheltered homelessness, all the way up to market home ownership. And we know that people's housing journeys are fluid. It's not necessarily a linear straight line from an experiences of homelessness all the way up to market home ownership. And we know that it's not desirable or even possible for all community members to reach the stage or to be home owners. And so the experience within the housing stability system and across the housing continuum is meant to be fluid and not necessarily just linear. So within the homelessness and supportive housing unit, the team that I get to work with a number of community partners, we really have three main roles and responsibilities. We fund and administer programs and services aimed at preventing and ending homelessness. We respond to unsheltered homelessness and encampments together with our partners. We support the integration of health and housing to end experiences of homelessness. And to that end, we are undertaking an ambitious plan across the community called the Plan to End Chronic Homelessness, where we are engaging with over 45 different leaders and organizations and partners throughout the community to create a plan, an action plan, and a roadmap to reach functional zero chronic homelessness by 2030. I could do a whole other hour at least presentation on that topic, which I won't do today, but maybe I'll drop some links into the chat later and include links on these slides. So just another slide, very briefly showing it's taking that housing continuum that I spoke to earlier and attaching some specific services and buckets under each of those, these four key areas within the portfolio that I work in, within homelessness, emergency shelter, transitional housing, and supportive housing. And not all of these services here are available to individuals. Actually, sorry, I'm going to correct myself. All of the services that I reference here, apart from PATH, which I won't get into in today's presentation, PATH is the only exception on this slide in terms of residency requirements. So emergency shelters, street outreach services, transitional housing, the Housing Resource Center, which we'll get into in just a moment, are all available to anybody, a resident within Waterloo region, regardless of residency. So the next few slides, I believe I have three there. I'm going to center on three key resources for all Waterloo region residents, regardless of residency status, that I think maybe are particularly helpful. So the first is what we call the Housing Resource Center and Rent Bank. So this is hosted by an organization called Lutherwood or Starling Community Services. I need to update these slides because Lutherwood has changed their name. They're undergoing a process to rebrand themselves and change their name from Lutherwood to Starling. So here on in, I'll refer to it by its new correct name of Starling Services. So Starling Services operates a housing resource center. So you can see the addresses there: Weaver Street in Kitchener, Dixon Street in Cambridge, open Monday to Friday, 8:30 to 4:30, available by phone as well. And so they offer supports and resources for folks to find and access affordable housing and housing generally. And by and large, their services are supporting people for self-directed housing searches. So they do run some online clinics, some workshops, they have one-to-one supports, but it's meant to be a light touch support for folks looking for access to affordable housing or rental housing in the community. And so as you can see there on the top in red, they offer virtual and drop-in supports, housing search support sessions online, and some other online services. Now I'll dig in a little bit into the rent bank. And so the rent bank is offered and supported by Starling Services. And you can think about the rent bank in two buckets: eviction prevention and last month's rent. So eviction prevention helps households who have arrears, they haven't been able to pay their rent, and can provide a loan or a grant to help people address those arrears and pay off those arrears. I'm not going to get in today in terms of a number of the eligibility qualifications. That's best done through Starling, through the phone number that you see here, or through their website. But if an individual in the community is experiencing challenges in terms of paying rent, they have some arrears built up, a connection and reach out to Starling can be really helpful. And you can see there at the bottom that some of the documents that are required as part of the process include identification, proof of tenancy in the unit, proof of income in terms of ongoing income and ability to pay the rent, and proof of arrears from the landlord. And so if you or someone that you know is supporting an individual or household who's living in the community who's struggling to pay rent, Lutherwood and or Starling Services can be a really great resource through the rent bank. The other piece offered through the rent bank is last month's rent. So for low-income households or households in receipt of low income who are looking to move units and need support in order to pay the first and last month's rent that are often due when moving into a new unit. Luther Wood or Starling Services can support with that. I will highlight here that all of the rent bank services, so eviction prevention and last month's rent, are available for households living with low income, and that's part of the eligibility determination process. That's my last slide. Very quickly, there are a number of links included here. So through Luther Wood or Starling's website, they have a number of resources around eviction prevention, tenants' rights, legal advice. We heard some of that from the last presenter, and just some other great resources on Luther Wood Starling. I believe that's my last slide. So Tara, thank you for the opportunity. I will turn this back over to you.
Thanks, Chris, for joining us again today, and really helpful to hear about the services that people can access regardless of their status in the region. And I'm sure there's questions that will come back for you later when we get to the Q&A session. I would now like to invite, sorry, my pages are out of order here. Our next speaker is Paula Ballak. Paula is a rural community health worker and clinical nurse with the Woolwich Community Health Center. For 12 years, Paula has worked with agricultural families to offer farm, home, and road safety and other programming for our rural communities. Welcome, Paula, and we look forward to hearing about the programs and services that are available for folks in our region without an OPIP card. Nice to meet you too.
Nice to meet you. Thanks for the opportunity. You can hear me, right?
I can.
Okay. I am not great at technology, so I'm going to do my best to share my screen and do it properly. Here we go. Okay, and from the beginning.
And that's working.
Is it?
Yeah.
Can you see the screen or all of my junk on the side?
We can see the slides on the side as well.
Okay, give me 1 second. Saba was awesome to help me figure that out. So hopefully now it does. Can you see the slides now?
Yes, just the slide.
Okay, perfect. Awesome. So as mentioned, I work for the Woolwich Community Health Center, and that has 3 locations. One is in St. Jacobs, one is in Wellesley, and one is in Linwood. And we, yes, are rural, and I know we're not really talking to a rural population today, but we do have services that can be accessed through the Kitchener-Waterloo region or Waterloo region as a whole. So I'm really happy that we were given the opportunity to speak today. Normally, the health promoter, Tariq Abudali, would speak, but he's on another call. So I, as the nurse of the clinic, am going to give you just a brief overview. That's our community health center model. Not necessarily important, but good information. And this is what I'd like to tell you about today. We have some new funding that we're able to do a primary care access clinic, or PCAC. And this is for anyone who doesn't have a family doctor or a primary care provider, a nurse practitioner, or however primary care looks for you. And you don't have to live in Woolwich, Wellesley, or Wilmot. So like some of our folks who have to go to a walk-in clinic or have to go to emergency just for primary care, just for preventative visits, just for wellness visits, we want to take the burden off of those more urgent care places and leave them for urgent care. And we're happy to do the primary care piece. If folks do live in the townships of Woolwich, Wellesley, and Wilmot, they will be offered a permanent spot as a rostered client with one of our doctors or nurse practitioners. But again, if you don't, we will still see you. And we have PCAC access clinic days on Tuesdays, Wednesdays, and Thursdays. And if you do have a primary care provider, but they live far away, we can't necessarily see you, but we do have a social service worker who's a navigator of sorts. And I've heard the word navigator many times, which is an awesome resource to have because so many people aren't sure of what they can access and what they can't. So our navigator is Courtney, and she definitely can work with folks to figure out what they need, where they need it, and if they can't get it from us, where they can get it from. So the PCAC clinic, as I said, you don't need OHIP or health insurance or health coverage. This applies to every human being. So it doesn't matter what your status is. It doesn't matter if you are by choice not taking part in the Ontario Health Insurance Plan, or if you're new to Canada and waiting for your health insurance plan. It doesn't matter. We will see you. All you have to do is make a phone call and let the people at the front desk know that you need to see someone, and they will make it happen. Some of the things we do are vaccinations, we do preventative health, we do acute illnesses and issues. Not so much chronic disease management, but we can definitely see you and then get you onto the road to see someone who would be more appropriate. But yeah, that's basically the exciting part of primary care for us and what we're able to provide for people in Waterloo region. And then this is just one of the little flyers I hand out when I do a Tdap or an Adacel or a tetanus booster shot for some of our pregnant non-rostered patients. We do offer follow-up for the babies and for their older children as well. And we have a nurse practitioner here whose specialty is postpartum and newborn babies. So we're happy to care for any unconnected or unrostered children as well as the parents. And then some of the other programs and services that we provide that would not necessarily need to be a rostered patient to access are on this slide. And I would like to talk a little bit more in depth about music therapy, dietetics, and the social navigator piece. So if you found yourself with a primary care provider, but didn't have benefits or insurance to cover seeing a dietitian, a therapist, whether music or psychotherapy, so talk therapy or music therapy, or if you were looking for other social services outside the scope of primary care, these three people can definitely help you. And it doesn't matter where you live again, and it doesn't matter if you do or don't have health insurance coverage. They can definitely see you. And again, it's just a matter of phoning the 656-902 number, 25 number. This is just a general slide for overall health and well-being that we have kind of adopted social prescribing and social connectedness at our health center as just as important as seeing the medical side of healthcare. And as I say, we do have a person that is 5 days a week dedicated to doing social navigating, social prescribing. So if anyone is in need of any kind of services or helps, especially for those who are not proficient in reading and writing English, or we do have a population that has a low literacy level as well. Courtney can definitely do that. We also, in our rural area, we also deal with a large number of people who choose not to have cell phones or computers. And Courtney is very happy to either make a house call or come and help complete forms and applications someplace outside of the health center, or if they can come to the health center, do it here. And she's happy to do those kind of online internet forms for folks because they choose not to have the connectedness of the internet. And then pretty much the last thing I just wanted to mention is the dental programs. And I don't know if people have heard that there's not only a provincial program, but there's now also a federal program. And there always has been one for children under 18 that is called Healthy Smiles Ontario. So there are 3 dental programs that are available, and we actually have a dentist on site at both of our two bigger locations, Wellesley and St. Jacobs. So this slide is for anybody who's interested in that. The information's there. There's a lot of information. I'm not a dental person, so I don't know all the details off by heart, but Margaret has put herself out there to be the liaison for anyone who wants to know more about those things and how to connect with seeing our dental people for free for dental care. And then those are our 3 sites, and it's short and sweet. If you need anything, you can ask questions and look back on the slides, but otherwise, that's kind of us in a nutshell.
That was wonderful, Paula. Thank you so much.
No problem.
It's just really good to know that there are some health services and supports available for people in our community, regardless of what their status is. So it was really great to hear that. And I'm sure that there will be some questions for you in the Q&A. And I'd like to move on to our final 2 speakers that we'll hear from this morning before we do open up for Q&A with all of these panelists who we've been hearing from over the last hour. Please join me in welcoming from our settlement partners in the region, Martinez from the KW Multicultural Center and Sunanda Sachdev from the YMCA. Together, Annaluz and Sunanda will provide an overview of how settlement organizations in our region can and cannot assist temporary residents, refugee claimants, people without status in Waterloo region, and some of the services that are available. Thank you both for being here, and I understand that Annaluz is going to start today. So Annaluz, thank you for joining us.
Thank you.
I can see you and hear you.
Can you hear me? Okay, good afternoon, everybody. I think it's afternoon now. I will talk about specific programs that we have for people who are under the different categories that we talked this morning. The Multicultural Center provides services at the Kitchener Public Library and Waterloo Library, which allows us to paint a little bit of the eligibility criteria to those ones who have a temporary status. At the Multicultural Center, the main office, we provide services to refugee claimants. We have a person who is specialized on that area, basically supporting clients in the legal process. I mean, filling out the forms and then referring to the lawyers that can support them. And then we have some programs that are open for all categories that I will mention now. That is the conversation circles. We have the Let's Talk program, which is for youth from 14 to 20 years old. The cohorts happen at the libraries as well. We have a group that is offering at Cambridge Library, and we have one and 2 at the main library. Actually now in July and August, we will have 2 cohorts for youth that the idea is to encourage them to continue in the education. Then we have resume writing as well, who people can access that support in case that they need somebody who can help with that area. We have commissioner services for those ones who need to, for example, authorize a child to travel with one parent or a family member. That is a fee for services, but it's open to everybody. We see a number of people coming here for affidavits in different categories, single status, declaration on income, travel documents, for example. The other one is important to mention, that is interpretation and translation services for victims of domestic violence and human trafficking. And then we have a pre-employment program, which is specifically for people who have a permanent residency status. However, they have created a document that can help those ones who are temporary workers to help them to find some resources in the community. Actually, our services is referral to other services, the one had mentioned this morning, and other services that we are available. We also do some sessions at the library that also are opening to all services. I think that's all that I have to say, and I think Sunanda will continue with settlement services in the region. Thank you very much.
You're still on mute, Sunanda.
I have to share my screen, so I will be starting with the presentation. Great. Saba, are you able to share the screen? Thank you. So as Anna Lou said, we are reflecting on some portions of settlement services that are available to the non-permanent population, as well as for the people who are transitioning into the permanent status in this area. So at the YMCA of Immigrant Services, the easiest way to get in touch with is newcomers at ytr@ymca.ca. So whether somebody has a permanent status or temporary status, most of the needs are similar, whether it is the health, the schools, the legal, the immigration questions people might have, money and finances, employment, housing, and so many more. We have to remember that all these services need to be client-centered. Now, in the next slide, as you can see in the client-centered approach, that at the YMCA, we have especially 6 programs: the library settlement, the settlement workers in school, newcomer settlement program, our language assessment services, employment services, and community connections, which hosts the Immigrant Women's Future as well as conversation circles. These programs can be accessed by the refugee claimants, temporary foreign workers, international students, Canadian citizens. For the IWF program, they work even with Canadian citizens, but they have priority for the marginalized groups. There are provincial nominees, protected persons, visitors, and non-status. So these 6 programs can support them, and how they support them, I'll first start with the language assessment part, which is on the next slide. So if your first language is not English, and you were born outside Canada, you are over 18 years of age, you will be able to access this program. If you're a refugee claimant, you have been approved as an Ontario provincial nominee, you have a work permit, but you're waiting for the initial approval, or you have the initial approval of PR letter. You can access these programs, the Language Assessment Center. They will assess you for your English. They will be able to support you and refer you to a language program to improve your English further. If there is childcare needed or transportation needed, then that need can also be accommodated in this. Next slide, please. Our employment services, there is an eligibility criteria. So a person has to be over 18 years of age. They have 2 streams. One is the assisted services and the other one is the self-service program. Under the assisted services, it's the people who have permanent status in Canada. And this permanent status, when they have, it could be a work permit for the Ukrainians, or they could be refugee claimants as well. Now, the self-service could be refugee claimants, temporary foreign workers, international students, naturalized Canadian citizens, provincial nominees, protected persons, or visitors. So what happens in the self-service program, they will be able to use our public computers, and they get limited support to do your resumes, cover letters, and job search support. Next slide, please. When we are talking about investing in women's future, this program is offered only at our Kitchener site. So this is for the women who identify themselves as women or as non-binary individuals. They have to be 18 plus years of age. They need level 4 of English, and they can be any of the categories that we've listed over here. What does this program offer? It offers you industrial sewing. We have machines on site, and we have instructors who teach you how to use these machines. They will help you with the customer service basics, entrepreneurship. We also offer beginner and advanced computer skills. There is an employment and life skills counseling program as part of it. The computer skills that we are offering, this can be done online or in person. Next slide, please. The NSP program and LSP program is similar to what KW Multicultural Center is offering. In this program, we do provide settlement and integration support, not to a huge extent, but there is limited amount provided because there's a single staff who's handling this program, the NSP, and similarly, the LSP is a small program. They do run English and French conversation circles. These conversation circles are available online as well as in person. They provide information sessions on settlement-related topics. It is advised that they register for them, but if they've not registered, they can still come in as drop-in programs. Next slide, please. The settlement workers in school, also known as the Swiss workers, they are in Kitchener, Waterloo, Cambridge, and Stratford, Perth County. The program provides academic support, information, and orientation to our school systems, how you can register if there are kindergarten nights, any parent-teacher nights, you can join those programs. If you need interpretation for these sessions, they will be available. There's a neat program they offer, which is the Newcomer Theatre Project, which is in partnership with Empty Space. So the newcomer youth, they are in the high schools, some of the high schools, and they will get to join the program to learn theatrical skills and present it. There is a newcomer orientation week that comes up in the last week of August. So if there are newcomer youth who are going to be attending the schools, they can join these programs and they can get the orientation, what to expect in a high school. Next slide, please. There are some YMCA programs which are open to all. Our favorite program is the 3-month free gym membership. This is a trial membership, which is free of cost, open to everybody, whether it is a temporary worker, refugee, claimant, international student, anybody can join it. There are child cares, early on sessions, after school programs, our health and wellness programs, camps for children. There is the alternative school suspension program and newcomer youth program. Some of these programs, there's a cost to it. And if somebody is not able to pay for it, we are able to support with subsidies as well. Next slide, please. Again, to get in touch with us, you could use the newcomers at YTR email. And we are located in Kitchener, Cambridge, Stratford, St. Mary's, and our school settlement is in Kitchener. Thank you so much and have a wonderful day.
Thank you, Annaluz and Sunanda. This has been really helpful overview of the settlement services that are available for some of the groups that we're talking about in the region. I would now like to welcome back all of our speakers from the last hour. We're going to move into the Q&A portion of our session today. This is our final session, and invite Jenna to take over in moderating this part of the agenda.
Thanks so much, Tara, and thank you, presenters. I learned so much, as I always do, and appreciate it very much. I'd like to start off by just posing a question to our panelists, and you can each answer it if you feel you want to. But I think I'll identify a couple people that might want to speak to it, and then I'll move on to a second question, and then we'll hear from all the great questions that are coming in the chat. You know, in each of the different areas that each of you work in, wondering if you've seen something particular, a particular set of challenges that might relate to particular status. So or there's some people that have very particular challenges that are tied to very particular kinds of precarious status. And what challenges have you encountered in trying to address those? So thinking about a particular status that you've encountered and what some of the challenges have been. And so I was thinking maybe we could maybe first hear from, I don't know whether Imtenan, you might want to be able to offer something short and sweet about some of the things you've encountered and some of the challenges you might have encountered in supporting them.
Trying to think of an example, Jenna.
An example would be great.
Yeah, I'm trying to think of one. I mean, I can say like a phenomenon, but I think everybody knows this by now, that is becoming like very high volume. It's just the number of students who are discovering late in their Canadian journey that there is really no clear path to permanent residence anymore. And that you know, the express entry point system that they've been calculating for the past 3 years, of like every single time something happens, oh, I got 10 points, I got whatever. And now the draws are so small and the numbers are so high, and it's extremely difficult for people, especially if they're from like more modest educational programs, to get accepted in that. So that's something that we're having to talk to people about and encourage them to try to find jobs, but that's difficult too. So that's something that's very live in this region.
Thank you. Any of the other panelists want to comment on that question? Something come to mind immediately that you want to share?
I would like to join in and say, for example, we had some Ukrainian clients who had lost their IDs. Replacing the IDs without a Ukrainian passport is next to impossible. So those are the people who will lose their status and they will not be able to navigate the system. So those challenges are systemic challenges, and it's very difficult to overcome them.
Eduardo, do you have any particular comments?
Can you hear me okay with my speaker now? Oh yeah, I guess I kind of touched a little bit around migrant workers, but just kind of the fear of kind of speaking out or identifying conditions of whether it's living conditions or workplace conditions, just based on the, whether they're in the SOP program and they're already going to go back, but they're thinking that they might not be asked back if they speak out, or if they're just going to be sent home during the season. That fear is kind of definitely something that really limits kind of a lot of the attempts to kind of address workplace health and safety. But we see workers stand up, definitely, but it's definitely a fear based on their status, right? That they can be deported or sent home or not rehired back.
Thanks, Eduardo. Paula, I see you've unmuted.
Thanks. I was just going to say we have a couple of populations, a couple of communities that do tend to migrate back and forth to Latin America from here. And often their health care will lapse because they haven't been in Canada for so many months or however that goes. And sometimes by the time they get their health insurance back, they've already gone back again. So I think that's why the CHC model of care exists, because we don't bill OHIP. So any of the services that we do, I guess I just want to encourage people that we're respecters of all people. So it doesn't matter what your situation is. We can see you for no remuneration for healthcare or allied healthcare. That's all.
Thank you, which leads me into my second question, which is, what solutions have you come up with, or what do you find works to be able to address some of these, particular challenges or some of the most challenging situations you've encountered, or maybe some of the more widespread ones in each of your organizations. So anyone want to go first? I can name someone again. wondered, Anna Luz, if you wanted to participate and maybe address this one first.
Yeah, I mean, it depends on the challenges because, I mean, Sunanda mentioned the quit people from Ukraine who cannot now renew their documents, passport, for example. We have the same issue here because we have a person who is working with Ukrainian population, and because it's a systematic issue, the idea is to address that one through OCASI, that they will be able to talk to the federal government and build how they can change that issue, because then people cannot do anything, because they cannot renew passport, they cannot do anything, then will be without the status where they came here as a temporary worker. Now, as you said, they will lose their status and will be not a status person, and they're not eligible for anything. When they came here, they were eligible for all claimant services. Now, due to the circumstances, they will not be able. And when there are some systematic issues, what venues we have in order to address those? I mean, OCASI is one venue. We also need to talk to the member of the parliament to address this issue as well, that they will make those changes. One of the things that we see at the office that a number of people who are coming with an open work permit, who are the partners of temporary workers or students, and they come to our doors to get some support regarding employment, which we don't have that support, but what we have done is, I mean, employment have done an email that can send them with some resources. I mean, there are not many resources as well, because it's some of the questions that also people ask. I mean, we came here with this status. The government told us that we are newcomers, but when we came here, then we are not eligible for services. But at least what we have done is to refer to some services that maybe can help and try to do some info sessions that they can get that information that they need.
Thanks, Ana Luz. Does anyone else want to comment on of the panelists on anything that's worked or they find is a solution for addressing some of these kinds of challenges, either just broadly in the region or connecting up with other kind of organizations outside of the region?
I had a comment about using the OHIP services or getting the OHIP card. So we've been sending some of the Conestoga College students to Service Ontario on Duke Street. They would deny the cards, and the same person would go to Stratford and get the card. So there is that standardization is not there in the responses. So perhaps a one pager or whatever needs to go out to different sites that be clear on your communication, because every site cannot have a different eligibility criteria for the same clients. So that is sometimes challenging to navigate which center is going to be client friendly and which one is not. So Paula, a lot of people, we are going to encourage them to move them to the rural areas, Wellington and Wellesley, and also that they can get non-OHIP coverages now.
It is unfortunate that depending on which site for what service you're looking for, you may get different answers. I know we work with the 2 Ukrainian guest houses in this area, and it is a bit disheartening to hear some of the stories where somebody at this site told them one thing and then somebody at another site told them another. But I guess we do the best we can, right? But it must be difficult, especially for those who are desperate to have things move forward. Yeah, so please send your people, the people that you're connected with. We're happy to see them. Yeah.
If I could just say something quickly, Sunanda, what you said reminded me of another problem that we've seen pretty frequently too, which is that Service Ontario or Service Canada locations insist that the only proof of PR is a PR card. That's the only thing they'll take in order to, get somebody a piece of ID or anything else that they need. And so a lot of clients, they they said, I need my PR card. They might not even have enough days. They might have some, criminal issue coming up, and they believe that that's the only thing because they've been mistold that they need a PR card. And so we have to try to send them off with a letter saying a COPR, confirmation of permanent residence, is also proof. So it's very much what you're describing too, Sunanda, of like not all these offices really understand, what is proper proof of status and what isn't. And some people end up trying to renew these cards when they're not ready to do so, to their detriment, and then it opens up a big can of worms.
Yeah, and maybe it's when we need to do some education as well, because I mean, at some point, social services, Cherry Wars, I think, was asking for the same thing, for PR card. And if you read immigration information, I mean, the website says that PR card is not an ID document. It's not required for a person to have that one. It's the landed paper who does the status, the person. And what we did here is that we called social services and explained that the immigration website say this one, and now they're changing that. They are accepting the landed paper because it's affecting people when they don't have PR card. And I think this forum, I think it's important we address these issues, and how as organizations also we address these things with Service Canada, because they are also asking for a PR card. PR card is not a mandatory document. Yes. This one is to go to the federal government as well, and the provincial governments. But I believe that it's important to hear this one in these forums, but also to start doing some lobbying and that education say this is what it says in the immigration.
Thank you, panelists. I think what we'll do now is we've got some great questions in the Q&A, and I think we want to, or in the, what do you call that? The Q&A chat. And so it'd be good for us to get to some of those. There's some that are kind of, I'm going to group the ones that are similar, and so that we have time to address them. There was a question about what to do in the scenario where someone's passport expired and they've lost their status. Where can they go to for help? Are they eligible for temporary permit, for example? Similarly, thinking about basically if there's a situation where people have lost status, what is the best place to start for services in the region? Maybe I'll turn over first to you, Imtenan, since you raised issues of status at the beginning. Go ahead.
Yeah, so the second question is very broad. Like if you've lost status, it really depends what your status was and what options might be available to you. And of course, we are a resource for that. And the immigration consultants at the universities and everything, depending on what your immigration history is. But on the more specific question that you mentioned, if you lose your passport or your passport expires and you're stuck in Canada, we actually did a application for that exact scenario. So it was somebody who was a student, their passport expired, their status in Canada expired, and then they couldn't even leave because the student was from India. He can't get a passport, a new Indian passport, unless he shows status in Canada. And he can't get status in Canada unless he shows an Indian passport. So this was during COVID, everything was taking a long time, but we managed to prove to immigration that he really tried and it's impossible. And so please give us a temporary resident permit so that he can then do his passport. And that was successful. So it's a long and convoluted process, but if you can really show the need, it's been tried and has worked in the past.
So one other quick legal question, in terms of legal services and resources for people that are out in the townships, I think you could also maybe address that as a starting point for us. Thanks.
Yeah, so the clinics do have some discretion to represent outside of our catchment areas. Usually, if the person either doesn't have a clinic in their in their catchment or their clinic doesn't offer immigration services, the next clinic can help them. But it's just not as automatic as if you were in Kitchener, Waterloo, Cambridge. So it needs a little bit of background authorizations, but people can definitely contact us. And something else I want to say is that summary advice is pretty easy for us to do regardless. So like, even if you're a little over in income, even if you're not exactly in our area, that's not so difficult. So please feel free to call. It's only representation that may need some extra permissions.
I've even asked for help before. Asking for advice, legal advice, immigration legal advice. So yes, thank you, Imtenan. One more legal question, which has to do with changing lawyers. I'm not entirely sure I understand the question, but it's by Syed Alam, who indicated how a refugee can change a lawyer if legal aid informed that the suggested lawyer was not submitting his consent. And so maybe that's a type of question that if you can't reflect on it now, it's a kind of question they might follow up specifically with your office for, if that case, it might be case specific, but maybe just generally about switching lawyers.
Yeah, so I can talk about it a little bit generally. So legal aid, because it's government funded, they don't like to allow a change of lawyer without a good reason, because they don't want to pay multiple times for the same case. But if you do have a certificate and you have a lawyer and you can demonstrate that there really is a problem, either they're not meeting their obligations, or like there really just is a bad situation between you and them, or a conflict has arisen, they may issue a second certificate. So the legal aid website actually has like a list of criteria about this. If you Google change of solicitor Legal Aid Ontario, it will show you a list, and they put in all sorts of things, like how long has the case been going? Was it very complex and we've already paid all this money? What stage is it at? So it's very much fact dependent. It is possible, but it should never be thought of as simple.
Thank you so much. So I have a couple of housing related questions that I think we could fire at Chris. So first, are clients with no status eligible for a shelter stay in Waterloo region? And then the second question was, could you please provide information on whether there are plans to increase the amount of social assistance offered locally? Is it clear? I'm just trying to read it at the same time. Okay. Is it also about, I'm sorry, I can't fully read the question. Is it clear that around ending homelessness tied to constructing housing? So I guess that the only solution is about constructing housing. And maybe you could offer some reflection on those two questions. Chris, can you take the floor?
Sure thing. Can you hear me okay? I see some nodding of heads. Sorry, I had to travel to an in-person meeting, so I'm just sitting in my car in a parking lot. So yeah, happy to answer those questions. So we do receive quite a lot of requests and information, requests for service around non-status residents. So whether folks be refugee claimants or on a visitor's visa, work visa, visitor's permit, a student visa. And so for short-term stays, like if somebody is in need of an immediate access to emergency shelter, the answer is yes. Emergency shelters in the region should be making themselves available to all residents throughout Waterloo region, regardless of status. There are some intricacies and places and spaces where situations where if individuals, so sorry, let me back up. Emergency shelter is meant to be the resource of last recourse. So if individuals have another place to stay, whether that be on a friend's couch or staying with a family member for a few days, if they need supports to travel to a different community within Ontario or Canada where they have social housing network of supports, they should avail themselves of those resources before accessing emergency shelter. Emergency shelter really is intended and operated as the last resort. That being said, I know that there are a number of refugee claimants, individuals on student and visitor visas in our emergency shelters across the region. As an example, we have about 32, 34 different families experiencing homelessness right now in Waterloo region, being supported by the YW in the shelter, and then supported with housing plan supports pieces by the family and transitions team with Starling. And so of those 32, 34 families, approximately half are refugee claimants in families with visitor or student visas. So the answer is yes, regardless of status, people should be able to access and can access emergency shelters. There are some, again, nuances. If folks can avail themselves of other resources, they are asked and required to do that. In terms of ending chronic homelessness and supporting individuals experiencing homelessness and ending experiences of homelessness throughout Waterloo region. So our goal and through the plan to end chronic homelessness is to reduce and eliminate chronic homelessness within the next 5 years by 2030. There is an over 100-page report that we went to Community and Council for approval back in April that outlines the strategies and actions needed to get to 2030. And we're working on an investment plan that will present back to Community and Council in the fall of this year as part of the Budget 2025 process. What I'll very quickly say is, there is no one size fits all. There is no one answer and solution. Like people, the issue around homelessness and chronic homelessness is a complex one. We're supporting people, and people are complex, so the solutions are naturally and necessarily complex as well. There are some private market solutions that need to absolutely be there. The private market plays a role in terms of affordable housing and ending chronic homelessness. That being said, I don't believe we can put all our eggs into the private market basket, seeing the low vacancy rates, the high rental increases, the stagnation of social assistance rates. We cannot count on the private market to end chronic homelessness in our community. There will need to be permanent, affordable, and supportive housing built by not-for-profits, co-ops, the region, the local tiers, lower tier municipalities. It will require an all-of-community approach to get to that goal by 2030. Happy to share my contact information and chat with folks offline about some of the strategies and actions that we in community are undertaking to get to that 2030 goal. I hope that answers the question, Jenna. If there's anything else, I'm happy to
Thanks,
speak
Chris. I thought that was great. I was just reading, there's a couple more questions in the chat more broadly that anyone on the panel that wants to answer could answer. The first is about information on food banks in the area. And we have talked a little bit about this, certainly in the earlier panel as well. Wondered if anyone wanted to pick that up, or certainly we can I think Anna Luce was going to type an answer, I saw. So that's good. And then also thinking about any access to or barriers to oh, my dog is barking, sorry, to transportation and travel services or transportation services in the region for temporary migrants. So wondered if someone would be willing to take on that one for us. Anybody? Takers on the panel? No? Anna Luz, maybe on transportation.
That's a big challenge because actually it's one of the thing that we have talked a lot for the Multicultural Center, that we have not been able to outreach. When we refer migrant workers, will be more the farm workers, that is not easy for them to come to this region. I mean, in general, there is no good public transportation in the region. I mean, there is not buses that goes to Sachdev, for example, where people can come here. It's an issue, and I don't have the answer. Sometimes friends bring people here. I mean, I have some people from that are working around St. Mary's. They bring them here for services, for commissioner services, or just for questions. But that is a big challenge. I think in general, public transportation is not good in Canada, and migrant workers are suffering those consequences because there are not any public transportation that could be accessible for them to come here. I mean, I know a person who brings them here to the Latin American stores, that they will be able to send money to buy some groceries, but it's just individuals who are providing that services.
I'll maybe quickly jump in to highlight,
Go ahead.
while not, ideal and work for everyone, Grand River Transit does have an affordable transit program for households with low income. I believe it's 48% discount on a monthly pass, and or the 2-ride tickets. And so I'd encourage folks to go and look up the affordable transit program with GRT. And then in terms of food assistance, there is a wide array of partners that come together as part of a coalition, a group called the Food Assistance Network. They are supported by the food bank. So as far as I understand, the Food Bank of Waterloo Region doesn't directly distribute food, but what they do is support this larger food assistance network and food delivery services like tiny home takeout, food hamper programs through community outreach programs, supply food to the Cambridge Self-Help Food Bank, help rural organizations and communities with food hamper programs as well. So I would encourage, I don't have a resource at my fingertips, unfortunately, happy to share it with Saba or Tara offline, but the Food Assistance Network and Food Hamper program throughout the region. I know it's in a number of different community spaces and community buildings. And so happy to highlight that offline. But yeah, it'd be the Food Assistance Network that folks should, our partners should tap into in order to get some food resources.
And I'll just flag that in the Q&A, some folks have put the link into the food bank as well. So you'll see that there as well. Did you have something else you wanted to add? Sunanda, go ahead.
Yes, Jenna, I wanted to say there are community outreach workers in the community. At times, they're able to give out vouchers that can support with these transportation costs.
Thank you. That's really helpful. There's also been a number of things are moving fast in the Q&A. There's been a few other responses to questions by folks as well. So I urge you to go and read those and see if there's something that we haven't actually managed to answer. For example, there was a question about eligibility for the eviction program, in particular, how a client can access the program if they have zero income due to loss of job, is working the process for being accepted to Ontario Works, for example. And Chris indicated that the source of an amount of income is an eligibility requirement for the rent bank, and to ensure that only those living with low income access the services. If a household does not have any income or insufficient income to sustain their current household or apartment, they may not be available for the rent bank. The household must have enough ongoing income to afford the housing and unit. The rent bank is an option for one-time payments, not ongoing assistance. So I hope that helps answer that question. I'm going to have a quick look to see if we missed any particular questions that no one got to in our quick discussion, and say we will happily share all the resources from here. I'd like to give our panelists one last word on what they think can be done to address gaps in supporting folks with precarious status in the region, and what we can do to enhance access to services for all. So, one-liner, a couple of ideas, that's it, and then we'll turn it over to Tara to wrap us up. Thank you. I'll start with Anna Luce, because your mic is off. You go. Go ahead. Mm-hmm.
I think these kind of panels are very important to discuss the issue. To learn from each other as well. There are a lot of services that are available. And then after that, I think how we take some action. We learn what the challenges are, and then how we can come together, discuss the challenges, and start talking about solutions that we can present.
Thanks, Anna Luz. Sunanda?
I would say collective, focused, and targeted advocacy is what would get us to where we want to go.
Thank you. Very concise, very focused, in fact. Imtenan?
Yeah, I don't have anything specific to say, but I think everybody agrees that immigration is just too bureaucratic. I don't know, somehow in their minds, like 5 years is a normal amount of time to wait to come, like for somebody to see their child. Like that's just, those are regular processing times. I don't really understand why our particular immigration service is that brutal, but something needs to change in that.
Thank you, Paula.
I would agree. I think a community focus, collaboration, working together, these kinds of forums are excellent. If we could work together and network together, I realize it's not lost on me that, you know, the far side of Kitchener is going to have a hard time getting to our clinics based on transportation, based on, you know, finances, et cetera. So I think working together, how Chris mentioned, you know, GRT, things like that. Yeah, I think we're all here and we all have a common desire and goal for the people of our region that do have those gaps. And so I think, yeah, if we can keep connecting and keep working together, we can fill those gaps. I'm hoping we can.
That is the purpose or the hope, right? Eduardo?
Yeah, I would say maybe, consistent outreach to and thinking about migrant communities that are often isolated, kind of consistent outreach, methods that they can kind of tell us what the priorities are. So with our project, we are doing a lot of needs assessment interviews for workers so that we can gather and prioritize what they're experiencing. And I'd say data collection, like for example, around pesticides for us, we kept hearing stories about migrant agriculture workers being worried about pesticides, but no one had really collected, like, you know, people I guess are concerned with wanting data. So now we're you know, formalizing an interview or a set of surveys for pesticide safety to really get that data to really then push kind of what we've been hearing, but collecting kind of formal data. So just kind of strategizing, I guess, around that.
Thank you so much, and thank you to all the panelists. I think we have the actual means among us to ensure access without fear, and what that actually means in practice is a lot more challenging than a policy, right, or even a statement. But it's so important that we're at this moment, I think, and we really appreciate everyone sharing their insights. We look forward to sharing more recommendations going forward. So thank you all very, very much. I really enjoyed the conversation. I think we tried to get to most of the questions. Those that we haven't, we will follow up with. I'll pass it off to Tara to wrap this up. Thank you, everyone.
Absolutely. Thank you, Jenna. And thank you again to all of our presenters today and to Jenna for moderating this final segment of our day together. I think it's been, and also to our panelists from our earlier session, if any of you are still around, on international students from our post-secondary institutions. It's been a really important conversation talking about populations that have unique circumstances and needs and access to services in this country, and to talk about the services that we have available to support them in all of their complexities. It's good to know that there are services available in the region. Hopefully the discussions today have given people what they need in order to be able to help the people who are coming to you for assistance to get to those services and supports that they can access in the community. And it's helped us to understand, I think, a bit more together where our gaps are. So thank you all for your active participation and engagement. I'm really grateful to all of you for joining this important conversation, to our several steering group partners, our funders, and our team members on the Immigration Partnership staff team who have all contributed to the success of this learning series and today's session in particular. These learnings are immensely valuable and I know are going to help people in our community who have precarious status. So I'm hoping that we will stay connected, stay learning, and continuing to grow the supports that we have available in the community for our temporary populations and people without status together. I would also, before I end today, like to invite everybody to look for information coming from us for the fourth and final session of this series, which will be scheduled in October. The final Brown Bag Lunch learning session this year is going to be in person. It will offer an opportunity for professional development, but also an opportunity for us to say thank you and express gratitude for the really important work that those of you who are working on the front line supporting newcomers in Waterloo region are doing. And we want you to know that it is noticed and appreciated, and we like to actually enjoy a lunch together. So look forward for the information that will come out soon, and please block the time in your calendars. We're really looking forward to having that time with all of you and working together to continue to build a vibrant community for everyone who is living here. When we come together in October, we will be addressing in the learning component, addressing language barriers and the employment services that are available in Waterloo region to support newcomers. Thank you all again. Enjoy the rest of your day, the last days of Indigenous History Month and Pride Month, and have a really wonderful summer. Take care, everyone.